So hopefully you guys can see my screen.
Yes.
Okay, good. So let's go from the beginning. Okay, so we're just going to do this update. We're going to go over these things really quickly and let you know where we are. And I did send this PowerPoint to Kristen, so she'll be able to share it. So I want to remind people that our guidance overall still is a strong mitigation framework where watch as a veteran once told me, wingspan, put your arms out and that's your wings and don't let anybody near you in that. Remember, it's 6 feet. Even though we are moving through strong and accelerated immunization phase in the county, strong mitigation still really matters. This is the key thing. We can talk briefly about the new CDC guidance about masks if you want, but and about if you have to quarantine after you've been exposed if you've had a full immunization regimen. But basically it's strong mitigation and then isolation and quarantine. Isolate is what happens if you're a case, if you're infected. Quarantine is what happens if you've been exposed, if you're a contact. I don't have a lot of information on that. If you fall into either of those categories, you should be contacted by the county, but I can also take questions on that too. I want to talk briefly about the vaccination overview. Our goal is to safely vaccinate the community as quickly as possible. We have an accelerated immunization plan that we actually developed late December, early January, and have pushed out. Dependent upon vaccine, which is all over the news, we can either vaccinate about half the county residents by June, or we do have a plan that would allow us to have full vaccination of the entire county based on those who are eligible, which does not include children. As you probably know, either 16 or 18 are not eligible. We're currently in the 1B priority phase, which means healthcare workers who were in 1A, law enforcement, education, childcare, and teachers, and those 70 up. We do anticipate going to 65 and up sometime in the next 7 to 10 days. The reason why we stratified 75 and up, 70 and up, and 65 and up is based on our morbidity and mortality data, and also the number of people that fall in those categories. Between 70 and 74, there's about 52,000 people in the county. Between 65 and 69, there's a little over that number, and we thought it best to stratify this. These are the doses given in Pima County. Actually, it's now 183,000. The state website now has all this information. So 183,000 doses have been given. I will tell you that when we started developing an accelerated immunization plan, our goal was 300,000 in 3 months. We are way over that target right now. And actually, I just did some data this morning. We expect to be able, dependent on dosing, to hopefully give another over 250,000. So at that point, we will be over 400,000, even though our goal was 300,000. And that's for our minimum plan, not our accelerated plan. So we are running, as you know, 5 pods. The state is turning the University of Arizona pod into a state-run pod. That means that pod becomes eligible for anyone in the state, very similar to what's going on in Glendale, for people to come. We do expect some of our southern county neighbors, perhaps some of our northern county neighbors will come down to the U of A to get their vaccination. As you may be aware, a soft launch for that on the 18th, which means there's a minimal extension of the hours, larger 10 to 10 on the 20th, I'm pretty sure it's the 22nd. So we're working closely with the University of Arizona. We did help them stand up that pod. We had always anticipated we needed a high efficiency, high throughput pod. You may be aware the county had originally proposed Rito. We are still working on plans for Rito in case we need that. But right now that emphasis will be on the U of A. The other places we have pods, Banner North, Banner South, Tucson Medical Center, as well as TCC. We also have done fairly significant outreach to our vulnerable population. We are this week releasing a plan to ensure that we have appropriate immunization and outreach to our vulnerable and disadvantaged populations. I'm pretty sure our administrator will be releasing that later this week, but the goal of that is to make sure that we have equity and justice. If you've looked at the data at all, and you can see all this on the state website, if you look at the racial data, Pima County is actually doing much better than most counties in terms of having our racial data reflect our population, but it's still not good enough. And so we have started doing some very targeted outreach to certain communities. We have also, as you may be aware, developed a plan for our rural parts of our county. They mostly include working with federally qualified health centers, Marana, United Community Health Center, and Desert Sunita out in Ajo. We did hold a 3-day pop-up mobile clinic in Green Valley last week, which was highly successful. We gave 3,000 shots, but we were unable to continue that this week because we did not have the vaccine availability. This is the prioritization of where we are. So the numbers get a little confusing. We're in 1B1D1. 1B1D is an add-on. You may be aware that the governor had added 65 and over. We subdivided that, like I've already talked about, 70 and 65. When these are done, we will then go to 1B2A, our essential workers. We are working with we do have an ethics committee. We're working with our ethics committee to figure out if there should be some prioritization within the essential worker community. As you see right now, there's a lump. Those are in no particular order. Those are just the order that got put in there by the CDC and the state. We have worked with the state. The state has not issued guidance in terms of how to prioritize within this community. We will be working with some labor experts to try to figure out, are there certain occupations within here that are more at risk? To remind you, that's really been our strategy, is how do we decide who is most at risk and then sub-stratify on that. That's what you saw with 75, 70, and 65-year-old. 1B2, adults in congregate settings with high-risk medical conditions, and you can see how that's defined here. Now, those are not individuals that have any of those diseases that are not living in shelters. These are people that are living in shelters or other congregate living settings. The other thing I didn't mention is our assisted livings and our long-term care. Long-term care assisted livings received vaccinations primarily through the federal system. However, we thought there was about 150, but it turns out there's a little over 100 assisted livings that did not sign up with the federal allocation that was CVS and Walgreens for a myriad number of reasons. We are in the process of going out to those facilities. They fall in 1A. There is about 100, we're down to about 102 of those facilities. We've done about 25 already. We have them in a queue to continue to vaccinate on site, obviously dependent upon our ability to get vaccine. So there is a fairly decent website with vaccine frequently asked questions. There is a helpline. Our helpline gets about 1,500 calls a day. This is a helpline if you are not using Banner. And you can obviously choose to go to Banner, and that's all on our website. As the U of A pod opens up, there will be another phone number, which will be a state number that people will be calling. And my understanding is that if you go to that now, you will not see the U of A site there. Our understanding is that will open sometime next week, and people will be able to get vaccination through there. I should let you know, because remember the vaccine is a 2-shot. We are right now entering into a fairly aggressive second shot. So if you think about it, if 3 or 4 weeks ago everybody was a first shot and it took all the availability, the next 3 to 4 weeks are full of second shots and mostly full right now. That's because we are prioritizing second shots over first shots. You may be aware the CDC has said that you can go to a 6-week period, but it's not recommended. We just looked at the data. If we don't prioritize that, we will be out of the 6-week window by the time we could get people that needed second shots. So we have made a prioritization for second shots. So what it means is that there's fairly, we anticipate limited availability unless we get significant increase in vaccine for the next few weeks for appointments. I just want to show you this. This is a slide we've showed before. This gives you a sense of our vaccine allotment. Just to be fully transparent, we have no idea what the state allotment is. We have no idea how the state makes decisions. We have no idea what the feds are doing, to be perfectly frank. What we know is the number of vaccines that we are allotted. And you can see we were at one point up to almost 30,000, and then we dropped to 17,850. We're actually waiting. We should have known last night, and we still don't know. So I can't answer the question, what are we getting next week? I have no idea. We will be given a number, and then we do an allotment based on what that number is. And because we are making this decision to prioritize second shots, we have asked all of our pods to give us a sense of what number they need to get to reach their second shots. This coming week, we are aware of what the appointments show. But I think that this is a very telling slide. And I just want to be very clear. We influence this by telling the state what we need, and then we get given a number. And you guys will get these slides. So let's do some goodness, because we actually seem to be doing better. This is our COVID-19 Pima County data. These are about what we call MMWR week. Week 1 is usually the first week of the year. So you can see that blip in the summer, that little blip, week 37, 38, that's the university blip. You may remember that. And then this really, what we call an epi curve that really looked like what the rest of the country was seeing. We did have the dubious distinction of being at one point the highest number of cases per population in the world. We seem to be really coming down from that here, but you can see these kind of numbers. Our highest week was that first week in January. Those are number of cases, so that's 9,000, almost 9,000 cases. Our goal is to have 100 cases per 100,000. That gets us out of the red. That means the total number of cases need to be less than 1,000. So you see that early in the pandemic. And then you see really this nice time, now nice in retrospect, in the summer and then the fall where we were doing well. And now we still have a pretty significant decrease to go to get to that 100 per 100,000, but that's our goal. These are cases by day, so it just gives you some idea. What we do in the cases by week is we just aggregate them. Cases are reported by testing, and the reason why sometimes the numbers change is that these are numbers that come to us from the state. So somebody tests, they get a result, that result goes to the state applies that to the Pima County numbers. So you can see that that can add a few days in there quite easily, sometimes up to a week. These are our deaths by date of death. And you can see since December and January, we've had a significant number of deaths. Let me go up a second here. The death rate is the worst it's ever been. You may be aware that we are now, I haven't done the calculation right now, but our death rate is probably close to 1 per 550 members of our county. And we just have seen this accelerated death rate. It is reflective of the accelerated case rate. Kind of makes sense. Hospitalizations by MMWR week. So you can see this, but this slide is a little more telling. These are the positive admissions that are attributed to COVID. This is from a different source than the state. This is from a local source that's filled directly by our hospitals. And you can see in December, we had high rates of admissions. Once again, we're seeing them go down, probably a reflection of not just the number of cases, but also we've really worked with many of our hospitals to make a monoclonal antibody, a therapeutic available for people right after they're diagnosed if they fall into the high-risk groups. And we know that that in itself is highly effective in terms of decreasing death, but also decreasing hospitalization. So our goal is to make sure our hospitals stay viable for everybody, independent of what's wrong with you. If you have an appendicitis or you have a cellulitis, that you're able to get the care that you need in the hospital. CLI is COVID-like illness. The only reason I bring this up is this is sometimes what we call an early leader. This gives us more of a sense of what we think we'll be seeing out in the next couple of weeks. So that other data is lag data. This is more, what do we think is going to happen? And the fact that we're seeing pretty significant decreases in these will hopefully portend well for us as we move forward. I want to remind you there's lots of information. There's a school dashboard, there's a business dashboard, there's Pima County dashboards. All of them are aligned, so the data should be the same. The percent positivity, the second indicator here, is important. Right now, our percent positivity is running 13%. You can see in mid-January it's 15.5%. We'd like that to be less than 10%. And we are seeing that go down, which is a positive thing. So other info, this is just reduced quarantine and close contact. You may be aware that you used to quarantine for 14 days if you were a contact. Now you only have to quarantine for 7 days, as long as you get a test and that test is negative. This is great news. We really pushed on this from an education and a business perspective to make sure people could get back in the workforce as well as back to school if their schools were open and not hybrid. And with that, I'm gonna stop sharing, and sorry, that was really quick.
That's okay, we can send out the slides and we appreciate your time. So let's go ahead and get started with a couple of questions. One of the questions that we had, you mentioned the second vaccine, is people are, you know, the mild symptoms, the fevers, chills, aches, or headaches. Is there something that can be done, either that's recommended prior to the injection or after the injection, that would help minimize those side effects?
After the
second vaccine.
Immunization. After the, I was thinking you were talking about the monoclonal antibody. Tylenol. There's no other way to really immunize them, to mitigate them. We know that the side effects are worse with the second immunization, and that's actually a good sign. It means that it's causing immunogenicity, which means your immune system is revving up. We haven't seen a very significant number of adverse events at all. Adverse events at the time, you know, the anaphylaxis, the need to go to the emergency room. We see a very, very few of them. And right now the national statistic would seem to indicate it's about 1 per every couple 100,000. So we wouldn't expect to see many of them. But in terms of a sore arm, the fever, the feeling poorly, myalgia, really just Tylenol and rest. We do tell people that are like if it's an organization and they're going to send a lot of people to get immunized and they're worried about the potential on work, that they might want to stagger people and not have a whole pod go in case everybody needs to take the next day off.
Thank you. Dave?
Kristen, can you hear me?
Yes, we
Great.
can hear you.
I've had technical problems all morning long, everybody. Thanks for being with us. Thank you, Terry. Dr. Cullen, more broadly, people are asking, when do we think that workforces can be immunized? And then when do you, and I know it's hard to predict, when do you think the thresholds will progress to people 65 and older, and then people younger than 65 in terms of vaccination?
We are hopeful that the state pod the U of A state pod will be compliant with the 65 and over guidance. So when that opens, which will be the 18th as a soft opening, we expect that guidance will change to 65 and over. We do anticipate that we will hopefully at our county assigned pods be able to do a similar movement sometime in a similar time period, Dave, but I don't know the exact number. We base it on the number of requests that are coming in for appointments. And so what you can imagine, right? We open up a new group, we get a lot of people coming in, and then we meter them, we get them appointments, and then it slows down. So we are seeing a slowing of the 70 and over. Now, some of this is that we know some people are going to Phoenix. We know some people, the one thing I didn't mention is there's some immunizations that have gone to the local pharmacies. So some people have been immunized there. People are taking every opportunity they can to be able to get a vaccination. So in terms of essential workers, we will not go to that until the 65 and over is done. And like I stated, we are trying to do some prioritization within the essential worker group itself. It may turn out that the state does that. We've actually asked the state if there's any guidance because that group is so large. And actually it's Maricopa and Pima that are most concerned about that, because for Maricopa, I think it's over 1 million people. And for us, the estimate looking at labor is that it's over 300,000. So that will happen after the 65 and over. Remember, if there is a third vaccine, which everyone is hopeful for, that Johnson & Johnson will have a third vaccine, that will be one shot, then there will be additional discussions, because right now it's this waved approach. You know, you do a first shot, you wave, you do a second shot, and then you can open up again for a large number of new people to come into the queue.
Thank you. Dr. Cullen, somebody has asked about the possibility of immunizations at the 2 hospitals here on the Northwest side, Northwest Medical and Oro Valley Hospital. Was there a conversation about possibly creating vaccination sites at those facilities?
So there's been a lot of conversations, and not just at those 2 facilities, but with what we call an onboarding process for not just hospitals, but also individual providers, right? So many of you have probably gotten a flu shot at your provider's place. As we move towards immunizations that do not require ultra low, so remember Pfizer, not really an option. And remember that was the first vaccine that was released, because the vast majority, well, almost nobody has the appropriate freezer that's needed for that. Moderna is a low need, low cold, is a strict cold chain, but not as low. Many people don't have that either. But as we move forward, we do expect in the federal plan is to really do many more what would be called spokes out there. So more and more places will have vaccine available. And you're seeing that with the pharmacies that have been allocated the vaccine. And we would expect that to also be part of the hospitals, as well as the urgent cares, as well as the individual providers. Now, when will that happen? I think Johnson & Johnson could be a big game changer. We know they're going to the FDA. I think it's the 23rd for an emergency use authorization. If that does happen, supposedly there's 100 million shots kind of on the shelf that will be deployed. And that is, first off, only one shot, and secondly, does not have as many cold chain requirements.
Dr. Cullen, somebody has asked about the shelf life of vaccines, and we hear these reports about vaccine, quote unquote, going to waste. Do you see that happening in Pima County, and do you have information about how long the vaccine lasts, if you will, before it's injected?
So it is that reconstitution and then delivery. Let me first talk about wastage of vaccine. You know, especially because there was some chatter up in Maricopa County that the Public Health Department had high wastage. They actually have very low wastage. Acceptable wastage is 0, right? Like none of us want any wastage, but 2 to 3% is considered acceptable. Maricopa is at 0.3% as a county. We are lower than that. We check on wastage every day. It's reported to us from are pods. When there is wastage, most of it is a needle that broke into a vial. If a vial has what we call particulate floaters in it, that FDA guidance is that you can't use that because the concern is that there may have been a problem in the manufacturing of that vial itself. In terms of wastage at the end of the day, because there's nobody around for a vaccine, we don't see that at all. And it's about 5 to 6 hours, Dave, after you reconstitute that you need to use the vaccine. But most of our all of our sites have become very adept at figuring out, looking at their schedule, knowing how many vials they need to reconstitute. And you may recall, in the best of situations, most of the time we can get additional shots from a vial than the vial has indicated. So Pfizer, instead of 5, we can get 6. If you're great, you can sometimes get 7, but that is taken into effect when people predict what kind of shots they're going to need. We do know in certain places, people have the ability to have a list of people that need to get immunizations, or there's people that are there at the end of the day. But our wastage is not an issue in Pima County.
One of our employers is asking Dr. Cullen, how can businesses check on their submission to be considered essential workers? And they were seeking clarification on what do you consider to be an outbreak in a business, and what should be done once that outbreak occurs?
Okay, so 2 questions. We are in receipt of what is submitted to the state for essential workers. That goes back to what we're trying to do in terms of prioritizing how we're going to approach our essential worker community. But the state does forward to us those lists, so we do have them. We're grateful when people enroll. We are aware that people don't get feedback right now, and that's because we're working with the state to try to figure out guidance on how we're moving to this next part. Outbreaks are actually defined by the CDC, and an outbreak in the case of COVID, obviously it depends on what the disease is. In the case of COVID, it's 2 cases that are epidemiologically linked within 14 days. So what that means is, if I'm your spouse and I work at the same facility you work at, but I live with you and we both get COVID, it's not an outbreak, because the epi link is not from work. It's when there's a situation in occupation itself or in school that allows me to believe that the transmission of the disease occurred in that location itself. That is not our definition. That we abide by that definition, but that definition is a CDC definition that has not been modified since the pandemic started.
Thank you. And Dr. Cullen, this is all new to everybody. And so someone's asking, once we've had both vaccines, how long is an individual protected from COVID-19?
Oh, I wish I knew the answer to that.
Sure.
I'll tell you, the CDC just released guidance that if you are fully immunized, you've had fully immunized right now means 2 shots. After J&J, maybe it'll indicate 1 shot, and you get exposed, so you're a contact. In the first 90 days after you're vaccinated, after you get full vaccination, okay, you get vaccinated, 2nd shot, 2 weeks before you're assumed to have immunogenicity. For the 90 days after that 2-week period, you do not need to quarantine, because the assumption is you are protected. After that 90 days, we don't know yet. And I would expect that there will be additional information that comes in for that in the future.
Someone asked, does the state's allocation to the U of A site, does that take away the number of vaccines or the total of vaccine that would be allocated to the county?
I don't know.
Yeah, sure. Okay. Here's a question. How effective is the Johnson & Johnson shot compared to the Pfizer and Moderna vaccines?
The data would indicate that there is some decreased effectiveness, but not in the areas that matter. Well, they all matter, right? But the area of serious disease, serious morbidity, and mortality seem to be comparable to what we see with Pfizer and Moderna. We are aware that there just seem to be through what we would call more breakthrough disease. So a higher percentage of people may contract COVID, but they will not get seriously ill.
Thank you. I know, Dr. Cullen, we just have a few more minutes left, and we sure appreciate your time. You know, you and I spoke at the start of this year, late last year, and you yourself had COVID-19 and had the experience of the disease firsthand. What did you learn, and what would you share about the importance of vaccination from your experience?
Yeah, I would share that. Yeah, I had a cold. I thought I had what was a cold. I thought but I don't usually get sick. So I got tested and I was positive. I immediately, as soon as I got tested, I isolated, which is what we recommend. And I live with my husband, and one of my adult children is home because of college. The good news is nobody else in my house got it, even though they live with me. So what it means is effective isolation is effective, that you can actually isolate. Of course, I recognize I'm privileged, and I had a separate bathroom and a separate bedroom that I could isolate in. But I do think this is not the flu, and I would remind people of that. I say, Dave, I say I came out of my COVID fugue. You know, there's a lot of neurological effects from COVID. It's why people get headaches. It's probably, you've heard post-COVID psychosis. I don't have that, as far as I know. But I worked through, you know, I remotely worked through my illness, but yeah, and just so people know, I have not gotten the vaccine yet, and I haven't gotten it because we are really in a constrained period. The CDC has now indicated that if initially there was a recommendation you wait 90 days, now they've said you don't need to wait 90 days, you need to wait 14 days since you've had symptoms. But because we don't have enough vaccine, I'm gonna wait the 90 days and then get vaccinated with the belief that I had a pretty whopping dose of COVID and I'm protected right now, so.
Somebody in the hospitality industry is asking, you know, people want to get back to business, of course. And there was the recommendation to ban out-of-state sports teams coming to play in Pima County. That was set to expire January 31. I believe that you all have recommended extension of that. Maybe you could talk about that a little bit, please, and tell us what your thinking is with regard to a resumption of normal business activity.
Yeah, so first off, I just want everybody to know, and Lonnie helps me figure this out, that our goal is to get to yes. We do everything we can to work with our businesses when they submit proposals that require county review. You may be aware that we are under a public health emergency that was declared by the governor. So the governor has given guidance that anything 50 or more people need to come to the county health departments for review. We are in the process and we have approved a few things. We were not taking any, we weren't even looking at anything when December we got those numbers. In January, we started looking at some things. We have approved some events. We are not approving spectators at this moment. As that curve, you'll recall that curve, as that curve goes down, we will be opening up. But for instance, the ice hockey team is playing, the Cologuard Classic is playing. I'm not picking on specific things, it's just what I remember. The Cologuard Classic is moving ahead, but neither of those have spectators at this time. We do work also closely with the University of Arizona. In case you wonder why you can see basketball on TV that the U of A does, I sit on the committee that helps guide what the university does. You'll recall that from well, you may not know, but those athletes are tested almost every day. They have a very aggressive isolation and contact tracing situation in place. And when we look at things, that's actually what we're looking to see. And that's why there's been still some delay in terms of the youth sports. I think there are some sports that are going to be opening up very soon. And Brian Eller, who's not on this call, he leads our school work, has more information on that.
Dr. Cullen, I know that you've got to run here, and Lonnie, we sure appreciate both of your time and the service that you're giving to our community. I know we have some other questions that we didn't get to, and I'll suggest that we field some of those and send them by email to Lonnie and Dr. Cullen and Suzanne and try to get some answers for people. We'll make the slides available, and we've recorded this session as well, and we'll share those with all of our guests today as well as our members. And again, thank you everybody for being here. Dr. Cullen, we know you're super busy. I'll remind our guests that next week we have another Let's Connect, same time, same station. And that's with Mike Boreal of Boreal Law. And Mike is going to talk about vaccine with regard to employment, both from the employer and employee side. What are your rights? What are your responsibilities? What can you and can't you require? And we sure hope you'll all join us then. We got an evening Zixer at 5 o'clock Thursday, the 25th. And then please join us on March the 4th for our Greater Oro Valley Economic Outlook. Again, ladies and gentlemen, thank you so much for your time, Dr. Cullen. We appreciate it, and take good care, everybody. Thank you.
Thank you, everyone. Have a fantastic day.